health-related mis- and disinformation has taken center stage in our information space since the COVID-19 pandemic. It's affecting our societies, influencing what we believe in, and increasing polarization. It can even impact our health. Good evening. My name is Maia Mazurkiewicz, and welcome to the Anatomy of Disinformation. Health disinformation has risen to the level of what experts call an infodemic. It's undermining public trust in science and health practitioners. Many of us now ask ourselves, what sources can I trust when it comes to my health and the safety of vaccines and other treatments? The World Health Organization has reported a rise in cyber attacks against healthcare providers and an increase in disinformation during public health emergencies. What are the main narratives of health disinformation? And how did it affect our response to the COVID-19 pandemic? Is disinformation used intentionally to polarize societies, exploiting our natural fear of illness? Our first guest is here to help answer those questions.
Karolina Wasielewska, journalist, reporter. Karolina Wasielewska specializes in women's issues and technology. She's the author of the books Cyberwomen, Female IT Pioneers in Poland, about women in computer science in pre-1989 Poland, Polka Gola, on women in football, and the blog girlsgonetech.pl.
Karolina, thank you so much for joining us today at the Anatomy of Disinformation. Today we're speaking about health disinformation. And we, as humans pretty much, heard about disinformation during the COVID-19 pandemic. That was a starter, but was it really?
No, it wasn't. Thank you for the invitation. Actually, I guess the most famous case of disinformation, the results of which we feel even today, dates back to the year 1998, when the first article on vaccines allegedly causing autism was published. And surprisingly, it was in Lancet, which is a very prestigious scientific medical journal. However, the doctor who published it, Andrew Wakefield, was later on delicensed, and it turned out that his research was actually a fraud. However, the results of that were really impressive, because in Great Britain, where the news about MRR, so measles, mumps and rubella vaccine allegedly causing autism was really widespread. So in Great Britain, it caused like 12,000 documented cases of measles among children in the next like 3 years. And it caused almost, a couple of dozen cases of hospitalization because of that. So I guess measles, which was like a disease of the past, suddenly became a disease of the present, yeah? And
this topic is still repeated by many.
Definitely. Yeah. However, the COVID-19 was a bit of was a different case, because this vaccine actually wasn't alleged to be, I don't know, poisonous or anything.
That was also the moment that we feared, that we didn't know what is happening.
Yeah.
So I think that everything that was around it made it even more significant.
Yeah, the situation was new for everybody. Nobody knew how it would develop. I remember that the argument that was most repeated at the time was that, well, because it all happened very quickly with the vaccine. I mean, it appeared on the market very quickly, so it means that it hasn't been thoroughly tested, which was untrue, because this scheme of vaccine was actually established a couple of years earlier. Yeah, so it was only the
disease itself.
Yeah, it was only the disease itself and the protein used to as a substance. The vaccine actually functioned as a vessel for this protein that was fighting the virus. So actually, the argument about the vaccines not thoroughly tested was really widespread, and it caused people who weren't like anti-vaxxers to reflect on whether I should get a vaccine or not. So sometimes these anti-vaxxers actions are quite subtle. It's not always, you know, an attack, a straightforward attack. Yeah.
But it's exactly being based on our fears as well, and and a bit lack of trust, right?
Sometimes it's enough to raise a doubt. Yeah. Even on a small scale. So that's what happened during the pandemic of COVID-19. Of course, the vaccines are, I think, the most common victim of fake news when it comes to health fake news, but not the only one.
Exactly, but there are also the other vaccines that was already kind of different cases. You were telling me about Denmark.
Yeah, Denmark was actually one of the countries that started an HPV public program, the elimination of HPV public program really early, because it was the year 2009 when they started the program, really close to what is happening in Poland now. I mean, the program was introduced in schools, so the girls aged 12 and 13 were the first beneficiaries of the program. And actually in the year 2015, the anti-vaxxers started spreading the news that the vaccine causes the girls to get sick. And the anti-vaxxers even produced a movie that was actually presented in Danish public TV. However, the message of the movie was that the vaccine was causing diseases, which was untrue, because if you take a group of, I don't know, 200,000 girls, let's say, then it may happen that among these vaccinated, some may have some other diseases, yeah? They are not completely healthy. So the link between getting the vaccine and getting sick was not really proven in this movie.
And did it cause something? Were there any protests?
Actually, the state reacted, because what the state did was moving on with a really massive information campaign on the effectiveness of this vaccine. And they also started an info line. It was a free phone number that every parent, every teacher could call and ask the questions about the vaccine. So that is how actually the program was saved, because soon after the activity of anti-vaxxers started, the percentage of girls who are getting vaccinated every year dropped to 40%, and then it raised to 90% again, thanks to those, well, wise actions by the state. Yeah. So
those are really changing and shifting the public opinion, right?
Yeah.
It can lower and also, as you said, rise the issue. And what is the situation now? Because you also said that it's not only the vaccines that in the health disinformation are being
yeah, I think if these were only the anti-vaxxers, online or offline, that we would be fighting against, the situation would be quite easy. But actually, health misinformation happens also not only outside the state, but also within the state. It is curious that today, for example, a person nominated for the Secretary of Health in the administration of President Donald Trump is Robert F. Kennedy Jr., who is actually a known anti-vaxxer. And he would be responsible for all the health programs of the American administration, which is really dangerous. Sometimes it also happens due to large amounts of money invested in some, let's say, fake news, just like Purdue Pharma did when it was promoting OxyContin as allegedly the first opioid that wasn't addictive. It turned out to be very, very addictive, but thanks to
the company work actually for profit.
Yeah, the company actually invested a lot of money in media releases, in lobbying actions, and also the articles about OxyContin being harmless, which was totally untrue, were published in not in some niche media, but also in Washington Post, New York Times. So people had the reason to believe that it was reliable. So the complicated thing about fighting with fake news in health is that it doesn't happen only, in some distant corners of the internet. It also happens within the state, it happens within the big corporations, and that's what makes the situation so complex.
And as with the immunity, in terms of the vaccines, you need to have a certain % of people vaccinated, so the society is safe of any particular disease. And
Yes.
It's very similar when we're talking about disinformation itself and knowledge of people. It's important that people are aware of what is happening, what is going on, and they are educated. Thank you so much for joining us. Let's take a look at examples of health disinformation.
Negotiations are underway with the pharmaceutical giant to obtain a nice fight for African independence, basing its research on the drug by
Health-related disinformation. Why spread it? Could you provide us with an example of the most significant or the best known such disinformation effort?
Going after health as a topic is useful for actors because it is something where there are a lot of questions that can get very complex and not all of the answers are known. We don't have perfect solutions in healthcare. So this creates fertile ground for disinformation actors to operate because they know that most people don't know the ins and outs of the medical system or how their bodies work.
But he was even more angry at the federal government and the pharmaceutical industry.
They might be former healthcare practitioners. One example was the fake documentary called Plandemic. This was an interview with a virologist named Judy Mikovits, and she had worked as a virologist, but had some papers that were later found to be not reliable and were retracted. She calls into questions a lot of the public health interventions and the incentives of people working in healthcare so that they might be, trying to profit off creating healthcare problems. By the end of it, she starts to go into a bit more off-the-wall theories, like wearing a mask would actually activate COVID in your body. What was interesting from a different disinformation angle was that they spread it throughout normal channels. And what they would do was they would say, see this before it gets taken down. They don't want you to see this, implying that there were powerful interests that didn't want you to have this knowledge. And they knew that the platforms were going to get rid of this content. So they encouraged people to share it as much as possible and put it up on other websites. And they linked out to other websites that couldn't be taken down. And with that, they were able to reinforce their narrative and they were able to spread very rapidly. This was fairly early on in the pandemic, so there were still many unknown facts about the origins or the effects of COVID. So they were able to fill in sort of the gaps of knowledge that was highly appealing to people.
Our next guest tonight join us to explore the critical issue of disinformation in the field of medicine. We'll discuss the importance of medical education in combating myths and ensuring accurate health information reaches the public.
Dr. Eryk Matuszkiewicz, specialist in clinical toxicology, internal medicine. He completed a specialization in internal medicine in 2011, followed by another in clinical toxicology in 2016. In 2022, he earned his PhD in medical sciences after defending his dissertation titled Acute Poisonings in Suicide Attempts Among Women in the Premenopausal Period. Since 2023, he has been serving as a regional consultant in clinical toxicology in Poland.
Eryk, welcome, and thank you so much for joining us straight from your cabinet. You are a medical doctor. Yeah.
Yes, I am. Thank you very much for the invitation. It's a great pleasure to meet you at your program. It's a great honor for me. So welcome everyone, and thank you once again.
Thank you. Today we are talking about health disinformation, and you as a medical doctor are having so many different people coming to you for advice, but are they fighting with you because they read something in the internet?
Yes, it's very, very frequent right now, because patients very often arrive to my cabinet with some certain information. They took it mostly from the internet. They look through different browser, especially it's a Google, and they put an expression, simple symptoms, or the name of the illness. And they try to find what the Google says about that. And they ask me whether it's true or not, whether this information is right or not. Sometimes they arrive with a fear because some informations are very, maybe not dangerous, but very frightened. They show us a very different scenario and very dramatic scenario. And they are afraid, does it happen to me? Will it happen to me? And very often I said, calm down, that's not true, that's not important, and it's not possible that it happens. So the internet is the one reason and one source. And the other one is our relatives, our friends, our neighbors. We ask them what helped them, what cure the doctors propose them. Maybe, and sometimes our relatives and our friends give us the medications because it helped them, so they suppose that the same medications will help the patient. Of course,
so very often they want to take the same medicine as their friends, even though they don't have...
Yes, because they thought in general, if they help one person, it should help me as well. But they don't take into considerations the whole circumstances, the indications, the contraindications, the health state, interactions. Sometimes they take different pills, different medications, and there are some interactions, and they don't care about that. The informations, these medications help me, so please take it. Of course,
and health is basically one of the strongest fear, right? We are fearing of our health, so that's exactly what they are checking for the internet. And usually they would be going to the doctor, but I understand that they are going only because they found something in the internet that might be frightening, or it can be a cancer, right?
Yes, of course. I know that our state health is the most important thing. When I am ill, I have no power. I have no interest for any other thing. So I can understand them when something wrong is going with them. That's normal. And as I said, I can understand it. But internet can give us some advice, of course, yes, but we have to verify it with a qualified person, a person who has a special education, who can differentiate between the right and the wrong messages and the right and wrong news, because in internet we have a lot of information. Every hour, every day, we have new informations about some experiments, some research which tells us that something is wrong or bad. And it's very hard. Usual people has a very big problem to differentiate it, and that's why this is also my.
Do you see any specific narratives in your cabinet? They are more frequent than others. Disinformation is very much touching the vaccination, for example. Can you see that there is a decline in this issue?
Since the pandemic, COVID-19, we have a lot of questions because in the pandemic we received the vaccinations and everyone doubted well, is it all right? These vaccinations were short time passed since they invented them. Maybe this is a kind of experiment, and the trust, they don't trust the scientists. They thought maybe there is some kind of plot, for instance. And we don't remember that infectious diseases, the viral infection diseases, the only one prophylaxis is vaccinations. As in any other medications, it's not possible that 100% will receive a treatment and will not observe side effects. Side effects always happen. But taking into consideration side effects and the right effects, achieving thanks the vaccinations, there's no doubt that vaccinations is the best thing that we invited to cure or to treat or to as a prophylaxis to viral infections or infectious diseases in general, because the bacterial, there is also a bacterial vaccinations. So there's no doubt that I have no doubt that we should be vaccinated for some certain diseases, because we did not invite anything better.
And coming back to the sources of information about health, you said that at least your patients are usually looking at the internet and friends and family. And do you think that we need the health education?
Oh yes, of course, because I believe that in our mind, in our no, maybe not the intuition, but in a good will. And if we received the right news, if we received the good and the proved information, we will make a good choice. Not the proven one informations are very loud, appeared immediately in the internet. We paid much more attention to these informations, and much more than for this calm one. I mean, this one where, that one which the scientists, for instance, give us. When some natural therapeutist tells us something, sometimes we believe him much more because he's louder. Maybe he has ability to tell us about that, because sometimes we use very terms which are not well understood, and people are disappointed because they don't understand it, they didn't want to listen to us, and someone who speaks clearly is listened to much more easily, much more willingly. So, as a doctor, I have to transform the information from the official one language to the in comma a patient language. So I believe in education, and I try to do that.
Perfect. And I have last question, but like really for 2 sentences. Do you think that communication for you as a doctor, it's crucial for what you said?
Oh, definitely, because patients needs to speak, to talk about it, and the contact between patients is the most important thing. I can't be silent. I can't be not talkative. Maybe not too much, but well.
Perfect. Thank you so much. I mean, exactly. That's the concept. Thank you so much for joining us and telling us about your experience as well, and how medicine is important. Thank you so much.
Thank you for our invitation. Good luck.
Thank you so much. Good luck. Let's now have a look at what exactly the term infodemic means.
What is an infodemic, and how does it affect public health? An infodemic is a surge of information, both true and false, that occurs during a health crisis such as a pandemic. This overwhelming mix makes it difficult for people to identify reliable information, leading to confusion and potentially harmful and risky health behaviors. Infodemics can weaken trust in health authorities and increase the spread of diseases, like COVID-19, by amplifying rumors and misinformation.
Our health is our greatest concern. We fear death. We worry about getting sick. And when we do fall ill, we fear for our survival. These vulnerabilities are easy targets for bad actors. Many of us turn to the internet to find solutions to our health problems. And with the rapid growth of AI, that's becoming even more common. But we need to remember that health information online is a battleground for disinformation actors. That's why it's crucial to check your sources and trust only those that are reliable. Until next time, keep calm and think deeply.